NHA CCMA Practice Test 2026. Question 1. A provider asks you to obtain a midstream urine specimen, but the patient is confused. As a CCMA, what is your best action? Collect a random specimen instead. Ask a family member to assist with instructions. Clearly demonstrate the cleansing and collection steps. Cancel the test until the provider reorders. Confused patients may not understand verbal instructions alone. Demonstrating the process ensures the specimen is collected properly without contamination while respecting the patient's cognitive limitations. Question 2. A CCMA is preparing to perform an EKG on a patient with Parkinson's tremors. What should you do to minimize artifacts? Perform the EKG standing up. Place electrodes on the thighs and shoulders. Ask the patient to hold their breath. Document tremor-related artifact and proceed. Tremors cannot be completely eliminated in Parkinson's patients. Documenting the cause of artifact provides accurate context for provider interpretation rather than attempting impossible corrective measures. Question 3. A child presents with multiple bruises in unusual patterns. The parent insists it was just from playing. What is your legal obligation? Report suspicion of abuse immediately. Wait for physician confirmation. Reassure the parent you will not report. Document only what the parent says. Mandatory reporting laws require healthcare workers to report suspected abuse immediately regardless of parental explanation. Failure to report can result in legal penalties and continued harm to the child. Question 4. A patient is fasting for blood work but becomes lightheaded while waiting. What should you do first? Offer them water and notify the provider. Perform venipuncture quickly before symptoms worsen. Instruct them to continue fasting until the draw is over. Cancel the lab test and reschedule. Water does not break a fast and hydration helps prevent syncope, fainting. The provider should be notified if symptoms persist, and the draw may need to be rescheduled or modified. Question 5. Which of the following would require placing a patient in airborne precautions? MRSA infection. Pulmonary tuberculosis. C. Diff colitis. Influenza. Airborne precautions including N95 respirators are required for pulmonary tuberculosis to prevent spread through tiny respiratory particles that remain suspended in the air. MRSA requires contact precautions, while influenza requires droplet precautions. Question 6. While assisting in a minor surgical procedure, the sterile field is accidentally touched by your unloved arm. What must you do? Cover the contaminated area with a sterile drape. Continue without saying anything. Inform the provider and replace contaminated items. Disinfect the field with alcohol. Any break in sterility must be reported immediately and corrected to prevent infection risk. The contaminated items must be replaced, and the field may need to be completely re-established before proceeding. Question 7. A patient with diabetes reports tingling and numbness in both feet during intake. What should you do? Document the symptom and notify the provider. Ignore since this is common in diabetes. Recommend over-the-counter pain medication. Schedule a foot exam without notifying the provider. Peripheral neuropathy is a significant complication of diabetes that requires medical evaluation. Documenting and alerting the provider ensures timely assessment and intervention to prevent further complications. Question 8. Which of the following requires use of a winged infusion set, butterfly needle? Drawing blood from a muscular adult. Obtaining blood from small fragile veins. Collecting urine samples. Performing intramuscular injections. Butterfly needles are designed for small or fragile veins common in pediatric, geriatric, or oncology patients. They provide better control and reduce trauma compared to standard straight needles. Question 9. A CCMA notices a sharps container is filled above the line. What is the safest action? Push sharps down to make space. Remove some sharps and place in another container. Seal the container and replace with a new one. Continue using until completely full. Overfilled containers increase needle stick injury risk. OSHA requires replacement when filled to the designated line. Never attempt to force more items into an overfilled container. Question 10. Which action is appropriate if a patient refuses a procedure? Explain risks of refusal and document the refusal. Attempt to convince them multiple times. Proceed since the provider ordered it. Delay documentation until the end of shift. Patient autonomy must be respected. The CCMA must explain the risks of refusal, document the refusal in the medical record, and notify the provider so alternative care can be arranged. Question 11. A patient with a latex allergy requires a blood draw. What is the correct step? Use latex gloves but work quickly. Use non-latex supplies, gloves, tourniquet, bandages. Cancel the blood draw. Have the patient sign a waiver. Using non-latex gloves, tourniquet, and supplies prevents potentially severe allergic reactions including anaphylaxis. Latex allergy is a serious condition that requires complete avoidance of latex-containing products. Question 12. A CCMA suspects the EKG machine is not properly grounded after repeated artifacts. What is the safest action? Continue with the tracing. Unplug and tag the equipment for inspection. Wrap wires and tape. Perform EKG manually. Faulty equipment poses electrical hazards including shock or fire. It must be removed from service, tagged as out of order, and reported for inspection before any further use. Question 13. Which action should be taken when handling a specimen for a cold agglutinin test? Keep it at body temperature until testing. Place it on ice immediately. Store at room temperature. Centrifuge immediately. Cold agglutinins are antibodies that react at cold temperatures. Specimens must remain at 37 degrees Celsius, body temperature, until testing to preserve accuracy and prevent false positive results. Question 14. A patient becomes unresponsive while sitting in the waiting room. What should the CCMA do first? Move the patient to a private room before helping. Search for their chart. Wait for family to arrive. Call emergency services and check responsiveness. Checking responsiveness and activating EMS are first priorities in a suspected emergency. Do not move the patient unnecessarily and begin basic life support if indicated while awaiting help. Question 15. While preparing a patient for Holter monitoring, what should you instruct? Avoid showering or bathing during monitoring. Remove electrodes when sleeping. Record only chest pain symptoms. Perform normal daily exercise only in the clinic. Showering or bathing can interfere with electrode adhesion and recording quality. Patients should keep electrodes dry and avoid activities that may dislodge them during the monitoring period. Question 16. A patient with anxiety begins hyperventilating during a blood draw. What is the most appropriate response? Stop procedure, instruct slow deep breaths, resume once stable. Continue drawing blood quickly. Ignore symptoms. Administer oxygen immediately. Calming techniques and halting the procedure protect patient safety and comfort. Hyperventilation can lead to syncope. Resume only after the patient has stabilized and is willing to continue. Question 17. A CCMA receives a lab result showing critical potassium levels. What is the immediate next step? Call the patient directly. Document only in the chart. Notify the provider immediately. Repeat the test without informing anyone. Critical lab values must be reported to the provider immediately for urgent management. Abnormal potassium levels can cause cardiac arrhythmias and require prompt medical intervention. Question 18. When performing venipuncture, which action can cause hemolysis? Using a small gauge needle with high suction. Gently inverting tubes. Allowing the site to dry before puncture. Using the median cubital vein. Excessive suction from a syringe or using too small a needle damages red blood cells leading to hemolysis. This can alter lab results and require recollection of the specimen. Question 19. A CCMA must prepare a sterile field for a suture removal. Which item would contaminate the field? Placing sterile gauze with sterile forceps. Reaching across with ungloved hands. Adding items with sterile technique. Keeping items within the sterile drape. Reaching across without sterile protection contaminates the field and requires repreparation. The sterile field is only maintained within the boundaries of the sterile drape with proper technique. Question 20. A patient refuses to sign an informed consent form but agrees verbally to a procedure. What should the CCMA do? Document verbal consent and notify the provider. Proceed without documentation. Sign on behalf of the patient. Cancel the procedure without telling the provider. Verbal consent is acceptable but must be documented clearly in the medical record and communicated to the provider. Informed consent requires understanding, not just a signature. Question 21. If a tourniquet is left on longer than 1 minute, what error is most likely? Hemoconcentration. Low potassium result. Diluted plasma. Reduced clotting factors. Prolonged tourniquet application causes hemoconcentration, concentration of blood components, as fluid shifts out of veins, falsely elevating certain analytes and affecting test accuracy. Question 22. A CCMA is preparing to assist with spirometry. Which patient action ensures accurate results? Perform short shallow breaths. Exhale forcefully and completely. Hold breath during the test. Inhale quietly and stop. Spirometry requires a full, forceful exhalation to measure lung function accurately. The patient must exhale completely and rapidly to obtain valid forced vital capacity measurements. Question 23. A patient expresses suicidal thoughts during intake. What is your responsibility? Notify the provider immediately. Ignore and continue intake. Call the patient's family instead. Tell the patient to return next week. Suicidal ideation is a medical emergency that must be reported to the provider immediately for intervention. Never leave the patient alone and ensure they receive appropriate mental health evaluation. Question 24. A provider instructs you to administer a 2 ml IM injection to a thin adult. Which site is safest? Deltoid. Ventrogluteal. Dorsogluteal. Forearm. The ventrogluteal site avoids major nerves and vessels, making it the safest IM injection site, especially for larger volumes. The dorsogluteal site risks sciatic nerve injury and is no longer recommended. Question 25. When applying PPE for contact isolation, which order is correct? Gloves first, then gown. Gown first, then gloves. Mask then gloves then gown. Goggles then gloves then gown. Gown is applied before gloves to ensure the cuffs of the gown are covered by gloves, maintaining full protection. This order prevents contamination during donning and doffing.